lot of patients, sir. Always they come to me whenever they have any health problem like diabetes or obesity or heart problems. They want an immediate result. Whenever I tell them it takes some time, they get exhausted. This is because of the attitude and also for the dopamine that is released in the brain. This is called the Siberia walk. How exactly it happens, the mechanism is what I want to explain. So the our brain contains a lot of synapses, means junctions. One nerve cell will talk to the another nerve cell through junctions. So once it crosses the third nerve cell or fourth nerve cell, the idea that you want to tell gets converted into hallucinations. So hallucinations, HADE pattern happens everywhere, called hallucinations, illusions, delusions, and endless thoughts of coming again and again. This is the biggest problem that I am seeing in younger generation. The moment they get into this pattern of continuous same thought process happening again and again, it gets continued for minimum 6 to 7 years. They are restless, helpless, sleepless throughout this period of 5 to 8 years. Because brain central main brain or the cerebral cortex is nothing but a repeater organ. It is like a computer. Once you feed it, it goes on repeating the same thing. This is called as central brain insulin resistance HOMA pattern. This is where I've been working since 8 years. This slide is the heart of the entire concept. Once you are unhappy, once you feel your what your goal or what you thought has not happened, immediately conflict will start in your brain. So for every thought process that you get, there will be primary and secondary sensations. So once you are unhappy, your dopamine gets released constant irregularly, periodically, and in multiple phases. This disturbs your sleep, and this causes high insulin produced. Unfortunately, with doctors, even now in physiology and anatomy, we teach that insulin doesn't cross blood-brain barrier and doesn't have any impact on the brain. But recently, after 2022, we found out that insulin plays a major role in gray, gray area of the brain, and most important parts of the brain, the lateral part of the hypothalamus and the ventral part of the medulla oblongata and nucleus amygdala and other nuclei. This is the called the golden triangle. This is where dopamine is being produced, and this is under control of whenever the excessive dopamine is there, it should be washed out by using a MAO enzyme, which is controlled by insulin. Once you develop insulin resistance, your brain doesn't listen to yourself and continuously goes on disrupting this nuclear pathway. Once the dopamine levels in the brain falls to very, very low level, you will develop depression and suicidal tendencies. So decreased insulin sensitivity causes mitochondrial dysfunction. Finally, your brain is nothing but a brain mitochondrial density. Once your brain mitochondrial density falls down, the amount of cognitive sense they able to make out and which is useful, which is not useful, how much to use it, all this will be gone.